Around 5 to 8 in 10 women and people will vomit during labour and birth, and it's an incredibly common symptom and sometimes can be positive. There are many reasons for vomiting during labour. So one reason is the fact that your uterus is very close to your stomach, and what happens is when your uterus contracts, it stimulates the stomach and anything that's in that stomach comes straight back up. The next thing is oxytocin. So our naturally produced oxytocin within our body, one of the wonderful side effects of oxytocin is that it can make you feel very nauseated and sick in high amounts. And in labour, there are high amounts going through your body because what happens is you're producing oxytocin, the baby's head is onto the cervix, producing that feedback loop, and you produce more oxytocin and it keeps going. And the whole idea is to get baby out and for that cervix to thin out, open and dilate. But as a side effect of that, because you're continually producing oxytocin, it can make you feel nauseated, sick, and very, very unwell. The other thing to think about is acid reflux. So that can increase for some women and people during labour and birth, and that acid reflux in itself can cause vomiting too. For women and people with hyperemesis, they often find that they vomit throughout labour as well, and that's partly because of the hormones and the placenta and everything else. And then just to top it off, induction of labour medications can make people feel nauseated, can cause vomiting, things like prostaglandins, for example. The pain reliefs that are offered during labour and birth, so dihydrocodone, for example, pethidine, things like gas and air, epidurals, they can all cause nausea and vomiting. It's always worth asking your midwife if you can have an anti-sickness medication. They can be given, they are given via an injection, usually into your thigh or your bum, for example. Alternatively, if you have got a cannula because maybe you're having an induction or you've got an epidural on board, you can have them directly into your veins, which is much quicker acting. Sipping isotonic drinks little and often will help to maintain your sugar levels, your energy levels, and also keep up your hydration during labour and birth. But it's also worth thinking only small meals, small snacks throughout labour and birth, nothing really big, because that will help reduce the amount that's in your stomach, and that will just mean that you're more likely to hold on to it rather than all those contractions. Now, there is one stage I particularly love vomiting in, and that is during the pushing stage. And that is because as the uterus is really contracting and pushing, it's stimulating those stomach contents. And often if a woman or person is entering that pushing stage of labour, the moment they start vomiting, actually the vomiting, and because of the impact on the stomach muscles, actually helps the pelvic floor to relax, and that baby just flies out. And what that means is the woman or person has to work less hard because the vomiting and the action of vomiting on their pelvic floor does the pushing for them.